is Medicare?
I don't know, I guess right around 1965, President Johnson put the Medicare Medicaid programs into place to kind of help people turning 65 with their health insurance. It's changed a little bit since then. It's really expanded now, not just people that are 65. It goes into, it could be low-income families, pregnant women, people with disabilities, people who need long-term care. But there's two parts to it. There's Part A, which is the hospital insurance, and there's Part B, which is the medical insurance. And then during the Bush administration, they added a couple things onto it. They added a prescription card benefit, which is referred to as Part D, and also the Medicare Advantage plans, which are like the HMO, PPO type plans, maybe more similar to your group health plans that people are normally used to.
How does Medicare actually work?
Medicare is basically, it's going to be your health insurance. It's going to cover your hospitals, your doctor visits, your specialist visits, labs, x-rays, therapies, medical equipment, diagnostic testings. In most cases, it's going to be your health insurance from 65 on.
What do you mean by most cases?
If you're 65 and you're still working and you're covered under a group plan, it's going to depend. If your company has 20 or more employees, then your group health insurance will be primary. You'll use that. If your company has 19 or less employees, then Medicare will be your primary insurance. If you continue with your company insurance plan, you have to have Part A and Part B of Medicare. Otherwise, the group health plan will not cover what Medicare is supposed to cover. And the same thing on the disability side. If you're disabled, if your company has 100 employees or more, same situation where the company health plan will be primary and Medicare will be secondary. But if your company has less than 100 employees and you're disabled and still collecting on a group plan, then Medicare will be primary. So in that case, you'll also have to have Part A and Part B of Medicare.
You mentioned prescription coverage and Medicare Advantage plans. Were they added later, and how do they work?
They were added later. The original Medicare plans did not have prescription coverage. And so during the Bush administration, they added a Part D benefit, which you could pick up separate. It's called a standalone plan, and that will cover your prescription benefits. And the Medicare Advantage plans were also introduced. You could pick those up also. You need to have Part A and Part B of Medicare, and you qualify then to put in for a Medicare Advantage plan. That would be like an HMO or PPO type plan. The HMO plans are going to be like your group health plan that most people are used to now. You're going to have a network of providers that you have to use. If you go outside of that network of providers, you have no benefit. The PPO or point of service type plans, you have a network of providers you could use, or you could use an out-of-network group of doctors, somebody that's not in that network. And they want to kind of steer you to use the in-network docs.
So what do you mean by steered, Al?
Steered, generally you're going to pay less if you stay in-network. It'll cost you less in deductibles, co-pays, coinsurance. Most people prefer to pay less, so they're going to stay in-network. So the company's going to steer you to use the in-network doctors, steer you away from using the out-of-network doctors. They all have to be Medicare approved, though. But some people still might go out of network if they have a specialist that they want to see, or maybe a particular hospital they want to see for some reason. So they might opt to pay the higher deductible just to see that provider. The Advantage plan could also cover your prescription benefit. A lot of times they're included in the Advantage plans along with some additional coverages like vision, dental, hearing, health and wellness programs, chiropractic benefit, even transportation to and from visits. A lot of these things are not included in the original Medicare plans. You might have to pay some additional premiums, so these are some things to consider. And something else, in the Medicare Advantage plans, you might have a primary care physician that you have to pick, and that's a doctor or provider that would give you a direction in your medical stuff. Like, for instance, if someone had a headache, they could go to 13 different chiropractors and neurologists trying to figure out what it is. If they went to a primary care physician, maybe he says, have you had your prescription on your glasses checked lately? It could be just something as simple as that. Hopefully he would direct you in the right direction, and makes it a little bit easier. But these are definitely things to consider in making a choice between the Medicare Advantage plans and the original plans.